Gastrointestinal diseases are common in animals. They affect the digestive system, which is responsible for breaking down food and absorbing nutrients. These diseases can range from mild, temporary upsets to serious, life-threatening conditions. Understanding the signs of gastrointestinal distress in animals is crucial for early detection and treatment. Animals can't tell us when they're not feeling well. They rely on us to notice subtle changes in their behavior and body language. As a caregiver, you are your animal's first line of defense. Recognizing the signs of gastrointestinal problems is essential for ensuring their well-being. Gastrointestinal diseases can affect animals of all ages, breeds, and species. Some animals may be predisposed due to genetics, while others may develop problems due to diet, environment, or underlying health conditions. By familiarizing yourself with the common clinical signs of gastrointestinal disease, you can provide valuable information to your veterinarian. This will help them make an accurate diagnosis and develop an effective treatment plan. Gastrointestinal distress in animals manifests in various ways. Recognizing these signs early on is crucial for seeking timely veterinary care. Here are some common red flags to watch out for. Loss of appetite or anorexia is a sudden disinterest in food or a gradual decrease in appetite that can signify an underlying gastrointestinal issue. Animals may refuse treats they usually enjoy. Excessive drooling. While some drooling is normal, excessive salivation can indicate nausea, difficulty swallowing, or oral pain. Regurgitation. This is the passive expulsion of undigested food or liquid from the esophagus. It often occurs shortly after eating and differs from vomiting. Vomiting. This is the forceful expulsion of stomach contents through the mouth. It may contain undigested food, bile, or blood. Changes in bowel movements. Diarrhea, which involves frequent loose stools, or constipation, which is difficulty passing feces, are common signs of gastrointestinal upset. Straining to defecate, known as tenesmus, indicates difficulty passing feces, often accompanied by pain or discomfort. Blood in stool, bright red blood, or hematochezia, suggests bleeding in the lower digestive tract, while dark, tarry stools, or melena, may indicate bleeding in the upper gastrointestinal tract. Abdominal pain. Animals may exhibit signs of abdominal pain, such as hunching, whining, restlessness, or guarding their belly. Swollen belly or abdominal distension can be a sign of gas buildup, fluid accumulation, or organ enlargement. Lethargy and weakness. Animals with gastrointestinal problems often become lethargic and weak due to dehydration, electrolyte imbalances, and a lack of nutrients. Understanding the structure of the digestive system and the function of each part helps pinpoint the location of the problem. The digestive tract is a long tube that starts at the mouth and ends at the anus. Lesions or abnormalities in different parts of the digestive tract can cause specific clinical signs. For example, problems with the mouth or esophagus often lead to difficulty swallowing or regurgitation. Diseases affecting the stomach or small intestine may cause vomiting, diarrhea, or abdominal pain. Issues in the large intestine typically result in changes in stool consistency, such as diarrhea or constipation. The nature of the lesion also provides clues. Inflammatory bowel disease, or IBD, for example, causes inflammation of the digestive tract lining, leading to chronic vomiting and diarrhea. Tumors, on the other hand, can obstruct the passage of food, resulting in vomiting, weight loss, and decreased appetite. By carefully evaluating the clinical signs and considering the location and nature of the problem, veterinarians can narrow down the potential causes of gastrointestinal disease. Section 4. From food to stomach. When eating becomes a struggle. The process of eating and swallowing, known as prehension, mastication, and deglutition, can be affected by various factors. Dental disease, for example, can cause pain and difficulty chewing, leading to decreased appetite and weight loss. Animals with oral tumors or foreign objects lodged in their mouth or throat may have trouble picking up food or swallowing. Neurological conditions can also impair the nerves and muscles involved in eating and swallowing. For instance, a condition called megaesophagus causes the esophagus to become enlarged and lose its ability to move food to the stomach. This leads to regurgitation, weight loss, and aspiration pneumonia if food enters the lungs. Observing your animal's eating habits and looking for any signs of difficulty or discomfort can help identify problems in the early stages. Section 5. Vomiting versus regurgitation. Understanding the difference. Vomiting and regurgitation are often confused, but they are distinct processes with different underlying causes. Vomiting is the forceful expulsion of stomach contents through the mouth. It involves active abdominal contractions and is often preceded by nausea. Regurgitation, on the other hand, is the passive bringing up of undigested food or liquid from the esophagus. It typically occurs effortlessly, without forceful abdominal contractions. Vomiting can be caused by a wide range of factors. These include infections, dietary indiscretion, toxins, pancreatitis, kidney disease, and obstructions in the intestines. Regurgitation is often associated with esophageal disorders, such as megaesophagus, strictures, or foreign objects. Understanding the difference between vomiting and regurgitation is essential for guiding diagnostic testing and treatment. Section 6. Decoding diarrhea. Types, causes, and what they reveal. Diarrhea, characterized by frequent loose or watery stools, is a common symptom of GI disease in animals. It occurs when the intestines are unable to absorb water properly or when there is an overproduction of fluids. There are different types of diarrhea, each providing clues about the underlying cause. Small bowel. Diarrhea is often characterized by large volumes of watery diarrhea, weight loss, and sometimes vomiting. Large bowel diarrhea typically presents as smaller, more frequent stools with mucus, blood, or straining. The color and consistency of diarrhea can also provide insights. For example, black tarry stools, known as melena, may indicate bleeding in the upper digestive tract, while bright red blood in the stool, known as hematochezia, suggests bleeding in the lower digestive tract. Diarrhea can be caused by various factors, including infections, parasites, dietary indiscretion, stress, and underlying medical conditions. Identifying the type and characteristics of diarrhea is crucial for determining the underlying cause and guiding treatment.